My name is Angela Wilson-Panisi, and I'm a physical therapist who works with patients recovering after surgery for breast cancer. The following exercises are recommended by the American Cancer Society and were developed with assistance from the oncology section of the American Physical Therapy Association. Treatments for breast cancer could include breast biopsy, lymph node biopsy or removal, breast conservation surgery or a lumpectomy, mastectomy, and breast reconstruction. These can all affect how well you can move your shoulder and arm, take a deep breath, or do your daily activities like dressing, bathing, and combing your hair. No matter what type of surgery you had, it's important to do exercises afterward to get the arm and shoulder moving again. Exercises can really help decrease the side effects of surgery and help you return to your usual activities. If you have radiation therapy after surgery, exercises are important to keep your arm and shoulder flexible. Radiation therapy may affect your arm and shoulder for some 6 to 9 months after treatment is finished. Ensure that you talk with your doctor before starting any exercises so you can decide on a program that's right for you. Your doctor may suggest that you see a physical therapist or an occupational therapist who will design an exercise program just for you, as well as incorporate other treatments to decrease pain and increase your tolerance of the exercises. You might need this kind of help if you do not have full use of your arm within 3 to 4 weeks after surgery. Some exercises should not be done until drains and sutures or stitches are removed, but some exercises can be done soon after surgery. The exercises that increase your ability to move your shoulder and arm can usually be started within a few days. Exercises to help make your arm stronger are added later. So today we'll take you through some of the more common exercises that women do after breast surgery. Talk to your doctor or therapist about which of these are right for you and when you should start doing them. Now, commonly, the exercises that we'll start with first should be done for the first 3 to 7 days after surgery. Don't begin them until you get the okay from your doctor. Use your affected arm on the side where your surgery was, as you normally would when you comb your hair, bathe, get dressed, and eat. So start using your arm so that you don't lose motion in your arm. Lie down and raise your affected arm above the level of your heart for 45 minutes. Do this 2 or 3 times a day. Put your arm up on pillows so that your hand is higher than your wrist and your elbows a little higher than your shoulder. This can help decrease the swelling that may happen after surgery. Exercise your affected arm while it's raised above the level of your heart by opening and closing your hand 15 to 25 times, and then bend and straighten your elbows. Repeat this 3 to 4 times a day. This will help reduce swelling by pumping lymph fluid back out of your arm. Practice deep breathing exercises using your diaphragm, which means that your belly will rise when you inhale. You should practice these deep breathing exercises at least 6 times a day. Lie down on your back and take a slow, deep breath. Breathe in as much air as you can while trying to expand your chest and your abdomen away from your spine. Relax and breathe out. Repeat this 4 or 5 times. This exercise will help you maintain normal movement of your chest, making it easier for your lungs to work. Do deep breathing exercises often and anywhere. Don't sleep on your affected arm or lie on that side. So the exercises that we'll go to next can be done as soon as your doctor says it's okay. They're usually started a week or more after surgery. So be sure to talk to your doctor before trying any of them, and here are some of the things to keep in mind after breast surgery. You will feel some tightness in your chest and your armpit after surgery. This is normal, but the tightness will start to decrease as you do your exercises. Many women will experience burning, tingling, numbness, or soreness in the back of the arm or on the chest wall. This is because the surgery can irritate some of your nerves, and these feelings might even increase a few weeks after surgery. But keep doing your exercises unless you notice unusual swelling or tenderness, and if that happens, let your doctor know about it right away. Sometimes rubbing or stroking the area with your hand or a soft cloth can help make that area less sensitive. It may also be helpful to do the exercises after you have a warm shower when the muscles are warm and relaxed. Wear comfortable, loose-fitting clothing when doing the exercises, and do the movements slowly until you feel a gentle stretch. Hold each stretch at the end of the motion and slowly count to 5. It's normal to feel some pulling as you stretch the skin and the muscles that have been shortened because of the surgery. Don't bounce or do any jerky movements while doing any of the exercises. You should not feel pain as you do them, only gentle stretching. Perform each of these exercises 5 to 7 times. Try to perform each one as correctly as you can to the form that you're going to see demonstrated for you here. And if you have trouble with any of the exercises, talk to your doctor. You may need to be referred to a physical or occupational therapist. Do these exercises twice a day until you return to your normal flexibility. Be sure to take deep breaths in and out as you do each exercises. These exercises are set up so that you start out lying down, move to sitting, and then finish with standing up. Good luck. Start with the wand exercise. Begin on your back, holding a broomstick, yardstick, or other stick-like object in both hands, palms facing up. Lift the wand up and over your head as far as you can until you feel a stretch in your affected arm. You should feel the stretch in the back of the arm and the armpit area. Inhale as you lift the arm up. As you exhale, lower the arms back to start and repeat 5 to 7 times. It's important to push to the point of discomfort, but not past pain. In addition, if you have an unaffected arm, you can use that arm to do more of the work, allowing the affected arm to sort of go along for the ride. It's important to avoid arching the back and lifting the ribs. The back should stay flat on the floor and the ribs should stay relaxed down in the front. This exercise will help you increase the forward motion of your shoulders, which will help improve your ability to reach into an overhead cabinet or wash your hair. Elbow winging. Begin on your back and clasp your hands behind the neck with the elbows pointing toward the ceiling. Move your elbows apart and down toward the floor as you engage the muscles of your back and stretch the muscles in the front of the chest. This exercise will help stretch the front of the chest and improve your posture. It may take a few weeks for you to gain the flexibility needed for the elbows to reach the floor. Return the arms back to start and repeat 5 to 7 times. Seated shoulder stretch. Begin sitting in a chair very close to the table with your back against the back of the chair. Place the unaffected arm on the table with the elbow bent and palm down. This arm stays still during the exercise. Place the affected arm on the table with the palm down and the elbow straight. Without moving your back or trunk, slide the affected arm forward toward the opposite side of the table. You should feel the shoulder blade move as you do this. Then, engage the muscles around the back and shoulder blade to pull back to start. This exercise helps increase the flexibility of the shoulder blade, which will impact your ability to lift and move the arm. Repeat 5 to 7 times. Shoulder blade squeeze. Begin sitting in a chair in front of a mirror, but do not rest the back against the chair. Your arms should be at your sides with the elbows bent. Squeeze the shoulder blades together, bringing your elbows behind you. You should feel the muscles in the back and shoulder blade area engage. Keep the neck relaxed to prevent the shoulders from lifting up toward the ears and engage the abdominal muscles so the back does not arch. This exercise helps open the front of the chest and strengthen the muscles in the back to help you improve your posture. Repeat 5 to 7 times. Side bending exercise. Begin sitting in a chair with the arms overhead and hands clasped together. Bend your trunk and body to one side as you take a breath into the side of the rib cage opposite of the direction you are bending. This will help you increase the stretch you feel in your rib cage, side, and shoulder. It's important to keep the weight evenly distributed in the sitting bones and not let the buttocks lift off the chair seat. This exercise helps improve the mobility of the rib cage, mid-back, and shoulders, which will help you with reaching and twisting activities. Return the arms back to start and repeat 5 to 7 times. Repeat on both sides. Chest wall stretch in the corner. Begin standing facing a corner with your toes 8 to 10 inches away from the corner. Bend the elbows and place your forearms on the wall on either side of the corner. The elbows should be at the same height as the shoulders. Keep the arms and feet in the same place and lean the trunk and chest into the corner to stretch the muscles in the front of the chest and shoulder. Engage the abdominal muscles to avoid arching the lower back. Repeat 5 to 7 times. Shoulder stretch up the wall. Begin standing facing a wall with your toes 8 to 10 inches away from the wall. Place your hands on the wall and slide the arms up the wall until you feel a stretch in the shoulders or armpit area. Engage the abdominal muscles to avoid arching the back. This exercise will help you improve your flexibility, which will make reaching overhead, washing your hair, and driving easier. Slide the arms back down to start and repeat 5 to 7 times, inhaling as you reach up the wall and exhaling as you come down the wall.